Alright, so what's a quick approach to arthritis? Here's how I approach them. So the first thing that we have to do is to define the axis. On the horizontal axis, you see monoarticular versus polyarticular, and on the vertical axis, you see the tempo, acute versus chronic. So let's go through each of these quadrants. Quadrant number one is acute monoarticular. This is going to be a patient who may have septic arthritis. Remember, the next best test in management is going to be arthrocentesis, and you are going to see a positive gram stain for WBC count greater than 50,000 with preponderance of neutrophil. Typically, this is going to be due to Neisseria or staph infection, but it can also occur in leukemia as well. So watch for pallor or weight loss. So if you have got a patient with acute polyarticular arthritis, which means it affects multiple joints, well, you're still going to be thinking about infectious arthritis, but you're going to be thinking more viral. Things like parvovirus B19 is usually the cause. But if the patient is a daycare worker, you should also think of chikungunya as a cause of acute polyarticular migratory arthritis. Now, with chronic monoarticular arthritis, you should be thinking of osteoarthritis. The joint pain is going to be worse at the end of the day, the first line treatments being NSAIDs. And finally, we have chronic polyarticular arthritis. This is going to be the classical script for rheumatoid arthritis. Key is going to be the prolonged morning stiffness greater than 30 minutes. And these patients are going to be treated with methotrexate. So let's do a quick rapid review summary. Acute monoarticular arthritis, you're going to be thinking of septic joint or gout. Acute polyarticular arthritis, you're going to be thinking of viral arthritis such as parvovirus B19, chronic monoarticular arthritis, possibly osteoarthritis, and chronic polyarticular arthritis, think of rheumatoid arthritis. But don't forget to ask about weight loss and pallor. Hope you have learned something. Bye bye.